All right, hello and welcome to this section of college in the time of COVID. This is wearing the mask and other good things you should do, a public health discussion of why we do the things we do. My name is Dr. John Bowser, and I'm with the Master of Public Health program at St. Ambrose University. Now, this is part one of four short videos, and this one is focused on thinking public health. But now, before I dive into the material, I just wanted to say congratulations and welcome to St. Ambrose University. You made a fantastic choice for your educational future, and I say that from personal experience, being a proud Ambrose grad. I came here in the fall of '98 and finished 4 years later with my bachelor's degree in marketing. Since then, I went on to get my master's in health promotion and my PhD in population health sciences from the University of Wisconsin-Madison. But while at Ambrose, aside from my schoolwork, I was involved in a couple different activities. I did theater. I was a radio DJ on KALA. I played intramural basketball and volleyball, and just really had a good time and allowed myself to sort of step outside my comfort zone and try some different activities. And if I had one piece of advice for you, not in a public health sense, but just as students, it'd be to do that. Try something new. College is the perfect time to try an activity that maybe you hadn't thought you could do before. So, but about the SAU Masters of Public Health program. So it is an online program. And that works for me because I live and work in Wisconsin. I'm a senior researcher at UW-Milwaukee, but being an online program, I'm able to circle back to St. Ambrose in this role. And in the program, I teach MPH 510, which is Global Public Health Concepts. Now, what MPH 510 is for a lot of students, it represents their first exposure to the field of public health. And this is because MPH 510 is the first course in the curriculum. So while I touch on some topics that students will work on more in depth later, my main goal in MPH 510 is to get people to think public health. Now, what does that mean? Well, it can mean different things to different people. So for me, my background is more in social and behavioral health, hence the title of this section on why we do the things we do. And so thinking public health can mean different things to different people. For others who are more into infectious disease epidemiology, they're more into the biologic things. But one thing that's consistent is while the most visible part of public health is the solution part of it, working with people in communities and in clinic settings, an equally important or perhaps more important part is tailoring things back to the start. What is the root problem that we're trying to solve, and what is the nature behind it? And that's what thinking public health is. It's peeling back the layers, in the case of social and behavioral health, on the behaviors and why they happen. So let's give an example. A common health behavior that we're interested in public health is people's diet, because a poor diet leads to outcomes including obesity, heart disease, diabetes, and other chronic diseases. So quick statistics that you've probably heard somewhere, somehow. 1 in 4 Americans consume fast food every day. Now that's on average. The average American consumes 130 pounds of sugar a year. That is an enormous amount of sugar, and about 3/4 of us don't have a healthy diet, meaning we don't have sufficient numbers of fresh fruits and vegetables and dairy and oils. Now, why is that? Well, first, let's look inward. Okay, as adults, many of the decisions of what we ultimately eat, they are our own, right? I mean, it is our final decision. And in the university setting, in a cafeteria setting, the options available to you, healthy and not, will likely expand quite a bit. So while it is our decisions, we can't ignore the fact that there are influences. Just like decisions outside of our diet, there are influences that impact things that we do all day, every day. So for diet, one of them is family and peer groups. What did your family eat growing up? What do they eat now? What do your friends like to eat? Where do you want to eat? All these things contribute to ultimately what is the final decision you make. Now, we know geographically in the United States, there are certain sections where rates of obesity are higher than others. Now, it stands to reason that in those sections of the country, the diet is different. It's a higher fat diet. And so people are, yes, making the decisions, but they're also consuming the foods and the overall diet that is the norm for where they live. And so this plays a big role into that final personal decision. But then there are also broader societal issues at play. So there are things called food deserts. Now, this is a general term which basically means a geographic area where healthy foods, so fresh fruits and vegetables, whole grain pastas and breads, really aren't available because there just aren't grocery stores in the area. Now, an estimated 23.5 million Americans live in food deserts. Half of these are low-income individuals. Now, this is important because for some people, they live in a food desert geographically, but they have the means to transport themselves to places where they can get fresh fruits and vegetables. But for low-income individuals, this ability isn't a given. And so they might be living in places where truly their options tend to skew towards the unhealthy side of things. Then there's other economic considerations. So others may have access to a supermarket, but financially, eating those healthy diet foods, it's just not possible. So as you see here, a 2013 Harvard study found that a healthy diet costs, on average, $1.50 per person per day more than an unhealthy diet. Now, $1.50 might not seem like a lot, but say you have 6 people in your household, that's $9 a day. Over a 30-day month, that's $270. And if your budget is very, very tight, $270 a month, that's a lot of money. And so physically the option is there, but realistically it's not. So to review on our health behaviors, basically this is to illuminate the fact that the decisions we make instantaneously sometimes ultimately are influenced by other factors that impact us directly and indirectly. Now, on a personal level, for you, peeling back the layers behind our decisions can help us in our efforts to make better decisions, which requires us to do a little bit of introspection. And in public health, understanding these influences helps us as practitioners to make more informed decisions about the interventions that we want to put in place to help positively impact these behaviors and ultimately impact the outcomes. Now, in the next 2 talks, we're going to focus on the socio-ecological model, which is a public health framework that is the science behind the decisions and the influences. And then we'll also talk about the science behind the suggestions specific to COVID-19.